Bine v-am regăsit, doamnelor, domnilor, aici la Sănătate fără frontiere, așa cum v-am obișnuit, alături de noi săptămânal medici de top din Turcia. Astăzi vom vorbi despre o problemă de sănătate care afectează femeile. Este vorba despre cancerul ginecologic. Alături de mine, prin intermediul StreamYard, se află profesorul dr. Tolga Tașci. Domnia sa este medic specializat pe obstetrică-ginecologie. Hello, doctor, can you hear me? Nice to talk to you, nice to see you.
Hello, everyone. I can hear you clearly. Nice to meet you too.
Okay, Dr. Tașci, as I said, you are a gynecologist specialized on cancer problem. Tell me first why gynecological cancer should be operated.
Because the main treatment of the gynecologic cancers are operation, surgery. Surgery is the mainstay of the treatment of gynecologic cancers. Of course, we have some alternatives like chemotherapy or radiotherapy, but the mainstay of the gynecologic cancers, including cervical cancer, endometrium cancer, or uterus, cancer of the uterus, tube and ovarian cancer, and vulvar cancers are included in gynecologic cancers. And the main treatment of these illnesses is surgery. Why these surgeries should be made by a specialist? Because gynecological oncology is a specialty achieved after obstetrics and gynecology specialty. Since the surgical treatment of gynecological oncology diseases is specific, determining the most appropriate surgery for the patient and administering treatment by physicians who received special education in this field will increase the chance of success and minimize the side effects secondary to the treatment.
Tell me, Dr. Tașci, please, what is exactly a gynecology cancer?
As I said, cervical cancer, cancer of the cervix, which is a part of uterus, and the corpus of uterus, endometrium cancer, tube and ovaries, and the vulva cancers are included in gynecological cancers.
Do women come too late to you when you talk about these types of cancer?
Sometimes, but in general, we can timely detect these illnesses, and our success is very high. Almost all patients, especially for endometrial cancer or cervical cancer, our success is very, very high. But in ovarian cancer, the patients admit us frequently too late.
When there's nothing you can do?
No, of course we can do. There is a lot of things we can do, of course.
Such as?
Comprehensive surgery. A comprehensive surgery to resect all the illnesses in abdomen. Sometimes we operate the patient for hours, 5 hours to 10 hours. And then after surgery, we give chemotherapy. Also in late stages, we have some success. So every time there is a lot of things to do.
I understand. Tell me, Dr. Tașci, which gynecologic diseases can be treated with a laparoscopic surgery?
Yes, laparoscopic surgery is very important for us, for gynecologists. We can use laparoscopy both for benign diseases and cancers. In benign diseases, we can say ovarian cysts, myoma of the uterus, endometriosis, uterine removal surgeries for various reasons, and uterine cancers are usually performed by laparoscopic techniques or closed methods. Also, early stages of ovarian cancer can also be treated with laparoscopic technique by experienced physicians.
Okay, tell me please, doctor, which are the advantages of the laparoscopic surgery?
There is a lot of advantages of laparoscopic surgery compared to open surgery.
Okay.
Patients recover much faster after laparoscopic surgeries. Post-operative pain is much less. Cosmetic results are extremely good as there is no extensive incision on the abdomen. In addition, postoperative intra-abdominal adhesions are much less common in laparoscopic surgery, which is especially important for young women considering pregnancy in the future. If the surgery is for cancer, other postoperative treatments like radiotherapy or chemotherapy can begin much faster and easier. And serious complications that patients, particularly with obesity problems, may experience after open surgery are much less in laparoscopic surgery. This is very important.
I understand. Please tell me, can cancer surgeries be performed safely by means of laparoscopic surgery?
Yes, for some definitive cancers, we can clearly say yes. The efficacy of laparoscopic surgery is the same as open surgery, especially for endometrial cancer and early stage ovarian cancers. Patients with these cancers benefit from the above mentioned laparoscopic surgery advantages with the same success rate. But for cervical cancer, for example, we prefer open surgery because open surgery is more effective in cervical cancer. But other cancers, we can use laparoscopy very safely.
I understand. Please tell me, Dr. Tașci, what should a woman do to prevent any type of gynecologist cancer? Prevention measures.
Yeah. Annually, gynecology examination is very important.
Okay.
Every woman should go her gynecologist annually, and should give examples for cervical cancer, which we call it pap smear or HPV test. And the young girls, especially young girls, but every woman can do that, but especially young girls should be vaccinated for HPV virus. Because
At
HPV
what
virus...
age? Please tell me, doctor, because it's a subject. It's a very important subject here in Romania. At what age do we vaccinate young girls from HPV?
They can be vaccinated as young as 10 years.
10 years.
10 to 12 years old. 10 to 12 years old. 2 doses of HPV vaccine is enough.
I understand.
But of course, if the woman is much older, up to 45 years, they can be vaccinated. But the most effective years are before the sexual behavior began. We prefer before 15 years old. But
15
every
years.
woman up to 45 can be vaccinated. But if you want the most prevention, it should be before 15 years old.
I understand. Is it important this HPV vaccine to prevent any form of gynecologic cancer?
Cervical cancer, cervical and vulvar cancer
Cervical cancer. Okay.
is a very important problem for Europe or for United States and all over the world, but especially in Europe and the Western countries, it's a very important problem.
I understand. And my last question, Dr. Tașci, is when is too late for a woman?
For what?
When is too late? Too late.
For what?
For a woman. When you talk about cancer.
As I said before, almost never too late. But yes, but of course our success rate can be low if they admit us too late. But
What means low? Please tell me.
what?
What means low? Low.
Low. What means low?
What are the chances for a woman who comes too late to you?
It differs according to the illnesses. But remember, there is always something to do for everyone. But of course, it's very important to go gynecologic examination without any suffering.
You said once a year.
Yes, if you don't have any complaints, please go your physician annually, once a year, yes.
And if you have complaints?
Of course, you don't wait.
Okay. I understand. Thank you very much for all this information, Dr. Tolga Tașci. Hope to talk to you soon again.
Thank you.
Doamnelor, domnilor, a fost așadar domnul doctor Tolga Tașci. Domnia sa este medic specializat pe ceea ce înseamnă obstetrică-ginecologie. Am vorbit despre ceea ce înseamnă cancerul ginecologic în rândul femeilor, evident. Până data viitoare, la o nouă întâlnire cu un alt medic de top din Turcia, toate cele bune, la revedere!